This video continues Chapter 12 of OEC 6, looking at substance abuse and poisoning. And specifically in this video, we'll look at some commonly abused substances and a little bit at the signs and symptoms associated with those commonly abused substances. So one of the first things to consider is something that may be an over-the-counter drug, but still has the possibility for being abused. Overdose is one of the most common poisonings of Tylenol worldwide and can be life-threatening. It causes irreversible liver damage. When used therapeutically, it has the possibility to treat pain. It's an analgesic, and it's an antipyretic. It can reduce fever. We see it in some combination medicines, such as cold medicines as well. The most commonly abused drug in the world is ethanol, and it's mood altering. A disproportionate number of motor vehicle injuries are caused by abusing this. Because of its common nature, its emergencies involving it can be encountered pretty frequently. They can be serious and even life-threatening. Why? Because it inhibits central nervous system activity and can slow down motor coordination and sensory input, such as we might encounter in a motor vehicle accident, or this being causal. It can lower one's inhibitions and lead to behavioral changes, but because of this CNS activity in which it functions as a depressant, it can depress the respiratory system, slowing down the rate of respirations. And we also have to be just advised that too much alcohol can lead a person to losing their gag reflex, vomiting, and aspirating that vomit, which is going to lead to airway obstruction, stopping breathing as well. Chronic alcohol abuse and then sudden withdrawal can lead to all kinds of adverse effects, such as muscle tremors and hallucinations. Another commonly encountered substance is aspirin, which we again use as an antipyretic. It's also an anti-inflammatory and an analgesic. It has all of these ideas. It's also a common ingredient of some combination drugs, such as cold medicines. But if overdosed, it can cause respiratory depression and profound systemic acidosis. Carbon monoxide is a byproduct of incomplete combustion, and its danger is the fact that it binds to hemoglobin in the red blood cells the same way as oxygen, but it binds more strongly. It does not exchange with CO2 in the alveoli of the lungs. It binds to the hemoglobin almost irreversibly. Because of that, because it displaces oxygen, because it binds to the hemoglobin irreversibly, oxygen is therefore not transported to the cells. And so you can imagine that we're going to end up with some life-threatening hypoxia. That incomplete combustion, be advised in terms of scene safety, think about outdoor settings or where someone is perhaps running a stove inside an RV or a generator. And if there's poor ventilations, that leads to the incomplete combustion. Cocaine is encountered, and it could be in the injectable form, which is cocaine hydrochloride. It could be in the smokable form, which is the freebase form, that's crack, and it's powerfully addictive. It's a stimulant, so people will feel very euphoric and energetic. We can see that the routes of administration, just depending on whether it's the hydrochloride form or the freebase form, can follow any one of these pathways. And it's that central nervous stimulant, so you can imagine an increase in heart rate and blood pressure, but an overdose, therefore, related to these things, could cause heart attack, seizure, or stroke. Ethylene glycol can be abused. The accidental ingestion can cause organ damage and so on. And we find it in a variety of household and automotive products. In particular, it's found in antifreeze. LSD, or acid, is a mood-changing drug. It's a hallucinogenic. Consequently, its effects are going to vary. Now, some of the physical effects, we'll see tachycardia and hypertension, but alongside that, we can see elevated body temperature as well. Because it has a hallucinogenic effect, large doses can amplify that. We can see delusions occurring. Marijuana, pot, weed, is legalized in a growing number of U.S. states, still not legal federally. Keep that in mind if you're patrolling on federal lands. The active ingredient is THC. The effects of marijuana really depend on the quantity of THC in whether it's been smoked or ingested in an edible, for example. Marijuana can distort people's perceptions, because it's mildly hallucinogenic, it's certainly going to affect their memory as well. Now, it may be used alongside other drugs such as alcohol and so on. We may see, in terms of administration, not just inhalation through smoking, but inhalation by vaping along with ingestion of edibles. Methamphetamine is a very powerful stimulant that has a high potential for abuse and addiction. Its popularity is growing because of its stimulant effects. It can decrease appetite, but chronic use can lead to, again, some of these psychotic episodes or hallucinations. Methane, typically not abused, but should someone be poisoned with methane, just be advised that it can cause profound hypoxia in the body. Although rare, death can occur. Opioids are gaining a lot of attention because of the opioid addiction crisis in the United States. Most who become addicted can eventually die. Fewer than 10% of individuals succeed in stopping that addiction. Now, those opioids include some of those opium byproducts such as heroin or morphine, and some of the synthetic ones such as fentanyl, oxycodone, or hydrocodone. Those overdose episodes can occur multiple times in a particular individual. Narcan will reverse the effects of the overdose initially. PCP was originally developed as a veterinary tranquilizer. It can be considered or abused alongside other drugs such as marijuana because of this tranquilizing use and the fact that it blocks the perception of pain. A person who ODs on it can become exceptionally violent, and it can increase their risk of serious traumatic injury because this pain perception has been blocked. And one thing to be aware of finally is the idea of polypharmacy, literally many drugs, where substances are taken in combination and the effects of the combination we don't always know. The additive effects of polypharmacy can produce some dangerous effects. Imagine someone taking 2 types of central nervous system depressants and the consequent effect on the respiratory system. Very dangerous, even in therapeutic or prescriptive setting, for example, with elderly patients who may be taking multiple medications just because the prescriptions come from different healthcare providers and no gatekeeper is watching out for those interactions. It's critical in a sample history in this case or in this population to make sure that the medications question is answered completely.